Hi, my name's Anne. I'm with the Hip and Knee program. I'm just going to go over a few things in regards to your hip surgery and this booklet that you're going to receive. Up here you'll see you have contact information for the Hip and Knee Navigator. They're your contact person if you run into any issues or have questions or concerns after surgery. You can give them a call and leave a message and we'll get back to you as soon as we can. As far as if you need to talk to a nurse more urgently, there is 811 available. That's a nurse's helpline. You can call any time of the day or night. They have pharmacists and dietitians and lots of really great resources, so you can call and ask any questions there. If you have any chest pain, chest pressure, or shortness of breath, you do need to call 911 and go to your nearest hospital. As far as exercises, the physiotherapist will go over your exercises with you. We want you to do numbers 1 through 4 whenever you're resting. That's your deep breathing and coughing, your ankle pumps to prevent blood clots, your static quads and glutes. Those exercises you should be doing whenever you're laying down and resting. Any of the exercises where you're laying down, those should be done on a bed or a couch, never on the floor. Exercises number 5 through to number 11 are the exercises that you will be responsible for doing 3 times a day. We want to make sure that you know it's up to you to do these exercises. Physiotherapy will go over these with you before you go home, and it's really important that you do keep up on your exercises. You should scatter them throughout the day. Instead of doing 3 half-hour sessions of physiotherapy, your pain may spike. So try to spread your exercises throughout the day. If there's a certain exercise that's more painful, take your pain medications, wait an hour, and then try the exercise again. As far as this booklet goes, it is about all sorts of hips. This approach of hip that you're getting is the direct superior approach. You do not have hip precautions with this approach because your iliotibial band or your IT band is not being cut. So these hip precautions are mentioned a few times in this booklet, and that does not apply to you. You may sit in a chair that's too low and it may cause you a bit of pain. So the next time you sit on that chair, you should add a pillow to the chair and see if that helps. We don't want you to force the hip to do something it's not ready to do. And if something causes you pain, don't do it. But you're not at as great of a risk for dislocation as when you have this surgery, the other surgeries. As far as there's signs of infection that we want you to watch for, as well as signs of a blood clot. As far as swelling goes, we don't want you just sitting in a chair all day long. We want you to limit your sitting to about 30 minutes, get up, walk around, do some exercises, and then lay down and rest. We do want you to elevate your leg a few times a day. You should also use ice on your hip. As far as the ice packs go, we only want you to put them on about 10 to 15 minutes, but you can repeat it every hour. As far as after hip surgery, it's normal to have some swelling. We want you to use ice to help mitigate the swelling. Some people report a warmth to the joint, and that can come and go for months after surgery, and that's normal. You may have some bruising around your buttock area and down the back of your leg, and sometimes even into your ankle. It's not a very gentle surgery, so bruising is expected, so don't be alarmed by the bruising. As far as pain control, we want to make sure that you do keep your pain well controlled. Typically with this approach, people need to be on pain medications for about 3 to 7 days after surgery. As far as the medications, we want to make sure that you have a base of Tylenol. We want to aim for 4,000 milligrams in 24 hours. So taking 1,000 milligrams every 6 hours gives you a really good base for pain control. Now you'll want to check with your pharmacist and see if the medication that you've been prescribed has any Tylenol in it and take that into account. The next layer of pain medications that we would like you to take is something called a non-steroidal anti-inflammatory. These are things like Advil or ibuprofen, naproxen or Aleve or Voltaren, and some surgeons may even prescribe Celebrex, and that will help to reduce the swelling. So we want to make sure you take your Tylenol with an NSAID, so something like Advil or ibuprofen, and then you can layer on the narcotic. A lot of times the surgeons will prescribe tramadol or Tramacet. So making sure that you're taking 4,000 milligrams of Tylenol with an NSAID and the narcotic. If you do have any questions about your medications, make sure you chat with your pharmacist. As far as constipation, we want to make sure that you do not forget about constipation. If you haven't had a bowel movement in 24 hours, make sure that you start taking some sort of a stool softener or laxatives. Everything's available over the counter, so talk to your pharmacist about what some good options might be. If you have something that works for you, you can keep taking that. As far as your dressing goes, you will have a waterproof dressing on your hip. What we want you to do is you can have a shower with that dressing on. You can't soak in a tub or go swimming or soak in a hot tub, but you are allowed to shower. Make sure that before you shower, your pain is well controlled, you've had a nice big glass of water and you're nicely hydrated, and you've got your support person nearby just in case you need help with something, and make sure you use your bath chair. The dressing that's waterproof is okay to stay on for 1 week. At the 1 week mark, we'll want you to change the dressing. We'll give you a handout as well as the dressing on how to change it. You take off the old and put on the new. We don't want you to clean the incision or anything. Just put on the new dressing, and that can last for another week. As far as the staples, those will need to come out between 10 and 14 days. We're going to give you a piece of paper that tells you where to call to make that appointment, and you'll come back to the ortho clinic to have those staples removed. And if you have any questions, you can always call the Hip and Knee Navigator and leave a message, and we'll return your call. Thank you.